Researchers in the UK are now saying race and ethnicity may make a difference when it comes to who is at risk for COVID-19. In particular, the research is showing black people are twice as likely to develop a case of COVID-19 than are white people, and Asian people are 1.5 times as likely. Research in the US is also showing Indigenous and Latino Americans are dying of COVID-19 at a higher rate than white Americans. For a closer look at this, we are joined by Raywat Deonandan, epidemiologist at the University of Ottawa. Thank you so much for being here this morning.
Thank you for having me.
All right, let's throw it right down. What does this say about the biological factor in the way COVID-19 and other communicable diseases affect people differently?
It's hard to disentangle the biological factors from the socioeconomic factors, right? Because in our society, race is correlated with wealth, and wealth is correlated with behavior, and behavior is correlated with exposure. So people who are non-white tend to be poorer, and poor people tend to have jobs in which they can't socially distance. They tend to have to use public transit where there's a lot of exposures. They tend to have lesser quality nutrition and lesser access to other sort of behavior modification tools like exercise. So I would say that most of the effect is probably due to these socioeconomic factors. However, you can't discount physiology here as well. So there's a reason that we seek out diversity in clinical trials to make sure that certain drugs like vaccines work on a wide array of people.
The number that I'm about to quote is probably the most surprising one of the morning for me. The Canadian Medical Association says 85% of our risk of illness is linked to social determinants, including income, housing, education, systemic racism, access to health care. Only 15% is linked to biology. You got to explain this to me. Explain why some populations are at such a higher risk.
Right. So these are the determinants of health that we talk about all the time. And the causality is difficult. Oftentimes, these are just proxy measurements for access to different kinds of care. So across North America as a whole, those who are the lower end of the socioeconomic ladder are less likely to have access to good health care. Good health care means screening. It means constantly monitoring your health for signs of vulnerabilities. For example, with COVID, we know that if you have hypertension or diabetes or obesity, you're much more likely to be hospitalized or die. And who are these people? They are the poor people because their diet is not as good, or their work doesn't allow them the time to take care of themselves, or childcare gets in the way, or they have to keep their kids in school rather than at home, and that increases their exposures. All these things accumulate. So there isn't one direct path to a bad outcome. It's a number of factors, all of which are somewhat related in some way to socioeconomic status.
Doctor, given everything you've just laid out for us, is there any reason to be concerned that vaccines could be less effective for some people?
Well, not really. Now, we do know that race is one of the determining factors that predicts antibody response. Hep B vaccines, for example, have different antibody responses for different ethnicities. However, the COVID vaccines deliberately have been trialed on a variety of ethnicities and races, and they're all showing high efficacy. So for that reason, there isn't a reason to expect the vaccines to respond differently. But it's important to note that this was intentionally explored just to answer that question today.
Raywat Deonandan, thank you very much. It's a difficult conversation, but all the more important to have. We appreciate your time today.
Thank you for having me.